sickle cell patients to have a sigh of relief as treatment is now to be covered by the National Health Insurance Scheme. We'll hear from the Sickle Cell Foundation exactly what they make of this by government. And joining us in studio this morning is Dr. Yao Asamoah, his secretary for the foundation, Amos Ando, founder of the foundation, Amwako Mensah Joseph, laboratory scientist as well, and he's a member of the foundation. Good morning, and thank you for joining us this morning, gentlemen. It's an all-men affair. What did you know add a woman?
Oh, we have so many women.
But when it's time to celebrate the good news, you left the women out. Why? That's not it?
They have been here with us, I think, when we were clamoring there was a poster day.
Okay.
We had Dr. Asman and then Albright. They were all here, so now it's
a turn for the men to also show up, right? Okay. Well, let me come to you, Doc. First of all, when you heard about this migration onto the National Health Insurance Scheme, I mean, what did you envisage? What kind of sigh, what kind of relief will this be bringing to patients?
Well, MFA, you can just imagine something that you have been working on for months, and so the moment we heard that news, it was a big sigh of relief for us, actually, as a foundation, because that was the major focal point when we had a sickle cell week celebration and also the World Sickle Cell Day. So that was what we put forward to through the National Health Insurance Authority. So when it came out that this is what government is about to do, it was a big news for us and for the entire sickle cell community, and then to us as FOCEL.
Okay. I mean, before the government even saying this, did it not have any subsidy at all? Was it entirely, the cost entirely was on patients? Is that the case?
Well, that one.
Okay, so with that one, you know, sickle cell disease, sometimes it has its own complications. So myself, I'm also a sickle cell warrior. So the foundation is not being founded by anyone just like that, but a warrior, and then who is also a journalist. So I'm using that skills to also create more awareness.
That's good to know.
But as you are saying, when it comes in the medication, we pay for everything on admission. Do you get it? Because we have some essential medication of which you use to treat yourself in the house, such as folic acid, hydroxyurea, and then sometimes vitamin C and others. Yeah. But when you get a crisis and you go to hospital, there are essential medication that they have to use to treat you, especially when you are in pain. Medication like tramadol, petidine, and others. And even sometimes you go in for a card as a sickle cell patient. When you have crisis and you are going to hospital, you have to go for renewal of that hospital card you are holding. You have to pay for everything. So I think it's a dream come true, yes.
I would have thought that the previous government had some sort of relief that already existed. Is this the case?
Yes.
And no?
That was prior to the, the election. And so sometimes you know that some of these, it was announced, some medications were announced, but till date, some are yet, or some warriors. Anytime we say warriors, we want to refer to sickle cell patients because they are really battling it out. And we are yet to have some or them going in for medication and having these ones scrapped off. And so we are only here to say that at least now it has been mentioned at a very high level in the UN. Okay. And it will never be taken for granted this time around. If the previous ones would say it's a political promise, we don't want this time to be in a similar manner. Okay.
Joseph, you are a lab scientist, and I can only imagine when you go through, people going through the test results, you seem to come face to face with it. Share with me your experiences, first of all, and how when it means you're part of the diagnosis process before the doctor will pronounce the person that they have sickle cell. You must have seen it and all of that. For you, how has the experience been for you, and how does this migration onto the National Health Insurance Scheme mean to you?
First of all, we would like to thank the government for this very important initiative. And so we at the health facilities, we come across them each day. And in fact, when you see them and their cases, in fact, it becomes so unfortunate on their side. Sometimes, as we are saying, financially, they become very challenged because they need to go through a lot of laboratory investigations. And because of the impact of the disease, we need to do a lot of testing, organ tests and other blood tests that we need to do for them. And it's in fact, it is costly, and they need to at least pay something because we need to do what you call HB electrophoresis.
English, please. Speak English so that we understand.
All right, that's fine. So it's just a simple blood test that we do to find out the type of hemoglobins that they have. Okay. So to know whether the client is AS, AA, SC, and the rest. So we can also do the kidney test and the rest for them because of the impacts that the condition has on the organs. And so, in fact, the clients are going through a lot. They go through a lot. So with this, it's a good news.
That's good to know. We're all excited about it, but let's focus more, at least, on the foundation, Amos. So for you as a foundation, what have you been doing before the government's addition to this? Okay, so,
you know, sickle cell disease, it can be, combated by only the government. I think the NGOs too, we are also contributing to that national, policy or implementation. So I think we at FOSEL, our main problem is we creating the awareness even for people to know their genotype before they start in giving birth to these children. And then aside that, we are in for people living with the disease. That's why we take this implementation as something that is a dream country for us because, you know, living with the condition itself is a burden. Yeah. Now, having financial crisis, even as a normal person, when you are going through financial issues, psychologically, you may not sound well. So see someone who is living with sickle cell disease, who is even thinking of tomorrow, what is going to happen to such a person. And so there's an issue that there will be a medication that will be restricted because they don't have enough money to cater for this. So, first of all, we keep on, creating more awareness on sickle cell and then pushing policies. That's our main focus because we know that like pushing these policies will go a long way, like what we've done so far. When we started the World Sickle Cell Day, we collaborated with National Health Insurance Authority, and it's a plus for them. We are so grateful to the National Health Insurance Authority. When they came, we pushed the agenda of this policy that you've seen that a lot of people living with sickle cell are suffering. And then the financial issues too is not easy for us at all. So the policy is to, at least the treatment should be on the National Health Insurance Scheme for easy access.
Right.
So, National Health Insurance Authority also did that report. They posted it, and then now we've seen what we are seeing now. So, aside we creating more awareness, making sure that people living with sickle cell disease to, cater for some of the medications, anything that they need, because it's not easy. So, we are there for policy implementation and also awareness creation. I think the two will help all of us.
Okay, Dr. Samuel, let's get into it properly because then when we have a lot of the numbers, government will be overwhelmed. They may be overburdened, right? Is this to suggest that it can be prevented? Does FOSEL at least focus on the preventive measures as well, on the education?
Yes.
You stated that people must know their genes, at least know which ones to compare with and all of that. But exactly. How easy or difficult is it to prevent it?
That is the main thing that we tackle. What FOSEL seeks to do is to create the awareness. We want to have a society where every single one, before you say, I do, you know who or what you are going in for. And so aside we pushing for this implementation of we having the sickle cell medication on the NHIA, our number one priority is to see to it that every single person knows about his or her genotype. And this is what we have done over the period that we came into existence. And to us, we think that if that one is done, at a point in time, government will have some relief, not to even think of sickle cell again. Because we don't want this to be forever. We want a society, a Ghana where, sickle cell is not a global something. It is restricted to some crop of races or people. And unfortunately, West Africa, Ghana, we are part of that category of persons. And so we're creating the awareness. Honestly, I, for one, the first thing when I supposedly would want to fall in love with you, to think of is to ask of your genotype.
You decide to want to fall in love with somebody.
Oh, yes.
Doc, you have my attention. You have my full attention.
In this regard, because...
Is there a test you run to be able to know that this person going out?
The first thing is I have to know your genotype.
Okay.
The moment I start to, I get to know your genotype, then other matters would follow.
Okay.
So this is the awareness that we are creating. That yes, a lot of people may fall in love or may, we can forgive our parents who didn't know. Yeah. And as a matter of fact, even till date, we may ask somebody who is highly educated about his or her genotype, and the person will be telling you O positive and other stuff. They don't know about their genotype.
Right.
You understand?
Right.
And this is the awareness that we seek to create. That the moment we get to that level, government should forget about even subsidizing or taking care of. Joseph, there would be a society without
sickle cell. Joseph, I'll come to you. Let me stay with Doc a little longer. So beyond the migration of these treatments onto the the National Health Insurance Scheme, I'm quite curious. The medication, is it available? Is it that it is available, but it is expensive? Or sometimes you actually have money, but you don't have access to the medication? So
I'll touch on a bit and then Amos will come in. So the medication is available, but expensive.
Okay.
We are talking about a population where the middle income earner is not able to afford most of the medication. For which reason, and it is one of the reasons why households would just rather keep their warriors at home. And sometimes, unfortunately, they pronounce some kind of things on them and associating it with spiritism here and there, you understand? So it is expensive, which is why to us, if government is able to implement this one, a lot of people, some people will tell you that sickle cell has a cure, and for which reason they'll be mentioning stem cell, whatever. How many Ghanaians will be able to afford that, MFA?
Good question.
So we assume that it doesn't exist. There's no cure. You only manage it. And the management, until you die, you have to spend a lot. I have come across a sickle cell patient where they have to perform surgery, removing the marrow here and there. Aside the financial burden, the pain on the individual. So the medication is expensive. And Amos has a very brighter experience when it comes to the availability.
Amos, the medication is available, but expensive.
The medication is available, but some of our remote areas, we all have the access to, but as he said, it's quite expensive. We have medication like the hydroxyurea. So, I mean, you were hammering on, the implementation of this policy that it was mentioned way back 2022.
Yes, for this particular medication, the one you just mentioned,
the hydroxyurea. So the hydroxyurea, I think recently, Kolebu, it was free. But if you go to other regions now, where I come from, central region, some of the hospitals, you have to pay for it. So, the medication that was being free for people living in sickle cell, this one you can get it at anywhere and to treat yourself. You see, now you can even have to, you have to go there and purchase that medicine before you can have access. But I think it was free. Aside that, we have tramadol, petidine, and co. Even to get the access to that medication, you need to be prescribed this medicine through a doctor. So you can't just go to hospital or any facility or pharmacy to procure, let's say, tramadol and then petidine. Tramadol recently, it seems it was imposed that even the government don't want even anyone to go and procure with that.
There's a ban on that.
There was a ban.
Okay.
Because people were using it to do the other things, you see. But we people living in sickle cell, even tramadol, sometimes you use it and then you don't feel anything. Because the pain is very, very high, severe, to the extent that the doses that they have to give it to you, it's even above 4 or 5 doses of tramadol. Sometimes, if they try the tramadol and it don't work, then they proceed to petidine and co. So this medication is very expensive. I think one sachet of the tramadol is about 70 cedis or so.
And how frequent must you take it?
Okay, sometimes you have to take it 3 times a day.
Okay.
1 in the morning, in the afternoon, in the evening, depending on how your doctor will tell you to take it. You see how it is.
Okay.
So the medication itself is available, but it's expensive. It's quite expensive for we, the middle class people. And you know, sometimes you have to even compare this with data, because now it shows that people living with sickle cell, we are everywhere. A lot of people are giving birth to people living with sickle cell. I think there's a saying that I think 18,000 each year. So people that are being birthed with sickle cell each year, no, it's 18,000 in Ghana. That is the average.
Okay.
So 18 to 20,000 every year. So these are the children that are being born with sickle cell each year. So can you imagine?
Okay. This is quite a conversation we may have to carry through until we see the implementation of this announced policy, right? But finally, Joseph, maybe I'll come to you. You, at least, have said that you have seen firsthand when people come and then they take their samples. How frequent is this? And I hope that this treatment also covers the testing, or it's just the treatment. It says the treatment. Will you come to play for a lab scientist? The work that you do, will you find it on the NHI scheme? Will it feature?
Yes, so now what we do for the baseline is the screening for sickle cell disease. And so if you have it, if you have the gene in you, you'll be told that you are positive. And then the positive, you need to go ahead to know your genotype, whether you are AS, you are SS. And so the moment you have the gene, we are advising you that never partner with anyone who has this gene. Okay. So what we are saying is the testing, I mean, the genotype testing, actually, it doesn't cover health insurance.
So you have to come and pay for that one.
Yes, you pay for that. But the screening phase, that one, it is health insurance covered. That is to know whether you are negative or positive. And so, as we are saying, about 2% of all the children born in Ghana, they have this disease. I'm
certain that we'll continue this conversation maybe at a good time, especially when we see it at the very implemented stage. But finally, when people are looking for Sickle, where can they find you? Okay, so focus on Sickle Cell Foundation. We are in Ghana, located in Winneba and Accra. Okay. So this year, we have a lot of policies that we want to even push. Some are in the level of the education, because we've seen that we lack the education. People are very ignorant about knowing their genotype or anything concerning sickle cell. And aside that, we have a lot of programs that we are going to run, at least to help people living with sickle cell. So this December, we are going to have Sickle Cell Fanfare. And we will be hosting it at the forecourt of Accra Mall. Okay. So this fanfare is going to, unite people living with sickle cell to clear stigma. And also, we are going to also partner with some of the pharmaceuticals companies here in Ghana for easy access for medication. You know, some of the medication, you have to use it to treat yourself in the house. Right. So with that one, you don't even need a doctor to prescribe to you, like folic acid. Even folic acid, you have to take it once a day. So if you have the folic acid, you can be taking it hydroxyurea and co. So now we are making sure that the fanfare comes through, so that, at least people living with sickle cell to have a dream come true when it comes in we uniting ourselves, because the stigma alone, if you tell someone that you are living with sickle cell, it seems you are not part of human. I think that's for a country we have made some great progress. So we are making sure that we clear the stigma. Okay. And make sickle cell something like normal for even the warriors to tell their story, to tell people, their friends and their family, oh, this is my condition. It's not like you have to hide your condition, even you don't want someone to know that you live with this condition. Yeah. So the fanfare is being featured on these issues. Okay. To clear the stigma and also to unite people living in sickle cell. Okay. Yes. All right. Dr. Samoa, thank you. Amos, Joseph, thank you. And congratulations, at least, for getting the government to do this. When this fanfare is done, I'm sure we'll pick up on the conversation. Sure. But thank you so much for joining us in the studio. You're watching the AM show. Please stay this more.